also trying to boost up the vaccination rate in Hong Kong, so that to try to contain the disease. And at present, the spread in Hong Kong is still severe, and we think that we may wait for a few weeks to see whether the current measures and also the vaccination will help to slow down the spread and progress of the disease. And for the requirements of wearing masks in the outdoor activities, so indeed, when there is crowded areas like outdoors, there's still a chance of disease transmission, especially for the Omicron, which is quite airborne, especially the short-range airborne transmissions. So with wearing a mask, especially a well-fitted tight mask, will help to prevent the spread of the disease even in the outdoor activities. So for the universal testing arrangement, there are many bureaus and departments are still figuring out the whole strategies and the protocols for this testing, which is quite a large scale of testing and operation in Hong Kong. So indeed, we will take very careful consideration about the infections control during the testing arrangements, like we did before for many restriction testing notice, and also the compulsory testing in different estates and places. So I'll leave Dr. Lau to respond to the hospital authority part.
Okay, up to this moment, there are around 1,200 hospital authority staff confirmed to be having COVID-19 disease.
No additional deaths outside public hospitals?
Sorry?
Are there any additional deaths outside public hospitals?
Okay, so Lau?
I just got the figure who died in public hospital.
Okay.
So.
問多條英文問題，後面嗰位。
Hi, CNN. In recent days, there's been a couple of cases where very young children have been separated from their parents, children who have tested positive for COVID and whose parents are still testing negative. I wanted to ask, why can't parents be with their sick and vulnerable children during treatment? How many infected babies and children are currently separated from their parents because of COVID-19? And how old is the youngest child? Do you think the threat of family separations might actually prevent families from bringing in their children when they are sick to the hospital? And finally, with universal testing happening in early March, we're definitely going to find out about a lot more positive young children. So does the government have capacity and resources to keep families together at that time? Thank you.
Okay. So thank you. So I think I will let Dr. Lau to respond to the hospital admission part, because I think we definitely know that if we can, we have to allow the parents to take with the children, especially sick children, not leaving them alone in the hospital. Yeah. So I'll let Dr. Lau to respond to the current measures and also the protocols of handling infected children. Okay. So for the universal testing part, yeah, this is one of the considerations we have to bear in mind, because of the for these operations, we think there would be quite a number of positive cases arising from these operations, and if there is children or even leave alone adults, so we have to take care of them after the testing. So this is one of the another major considerations arising from these major testing operations, which we have to handle quite 1,000 or 10,000 of cases, yeah, in a very short period of time. So Dr. Lau, please.
Currently, we will try to allow the parents to take care of the sick children in the ward setting. However, due to the limitations of the isolation facilities, as well as we worried about the infection control measures, some children may be taken care in the pediatric isolation facilities, which is like the other sick children. They are taken care by our professional staff, including the nurses, the doctor. Yes, we will case by case. We talk to the parents should see whether we can allow more visiting, for example, by the video conferencing or by other means that improve the communication between the children and the parents.
下一題，前面嗰位女士。
幾位醫生你好，明報嘅，想問翻醫管局咧，因為有啲醫護就向我哋反映，就話部分一啲無負壓系統嘅內科病房咧，就被安排去接收一啲確診嘅病人啦。咁就話淨係喺一啲病床嗰度圍一啲膠簾，或者係喺一個護士站度去圍一啲膠簾啦。咁佢哋都對個情況就表示擔心。咁想問翻醫管局知唔知係咪有呢個情況咧？一啲感染控制專家係咪覺得即係咁樣嘅做法就可以足夠去預防嗰個交叉感染咧？第二個問題咧，想問翻張醫生咧，即係有冇CHP 有冇再跟進調查嗰個立法會同埋政府係咪出現咗一啲司機感染嘅群組咧？因為有啲説法就話佢哋都成日喺立法會又或者係政總休息室嗰度啦，咁係咪導致即係一個比較大嘅交叉感染咧？涉及幾多司機咧？第三個問題咧，就想問翻，即係見到今日幾位醫生都公布多咗一啲數據分析啦。咁其實今日何柏良醫生咧都有建議話去公布翻一啲個案嘅年齡啊、性別啊，或者好似新加坡嘅做法去公布一啲患者有冇打針啦，或者係一啲需要聞氧氣嘅患者嘅人數啦。咁即係當局會唔會考慮去公布翻呢啲資料咧？同埋想問翻咧，我哋見嗰個居家檢疫名單咧，最後更新已經係2月19號嘅下晝3點，即係點解呢幾日都未有更新嗰個地址咧？唔該。
睇下先，我請劉醫生講講醫管局同事意見啦。咁跟住張醫生講講嗰個有啲特別個案嘅爆發先，好嘛？
嗱，我諗大家都明白而家嗰個疫情非常之嚴峻，就每日都好多病人確診。咁啊，等緊入去隔離設施嘅都好多。咁有部分嘅病人呢，佢係的而且確佢有一個病徵出現咗，或者佢需要咧喺一個醫院嗰度接受治療。咁我頭先都同大家講過啦，我哋其實而家可以用嚟接收新冠病人嘅隔離設施用到90%。其實以往係唔會用到90%嘅，以往其實7-8成咧就已經係去到最高嘅上限。我覺得去到90%咧，即係話我哋其實係已經遠即係超過我哋可以接收一啲新冠病人嘅情況。正係咁樣咧，我哋其實幾波之前第2、3波嗰陣時，我哋已經有一啲二線隔離病房啦。咁嗰陣時就係即係愛嚟接收一啲已經差不多康復好嘅新冠病人落去接受治療。但係喺今次嚟講咧，真係個疫情太過快，同埋要入院嘅病人太多，我哋係